Hello, my name is Kate. I'm going to be conducting your physical examination. Will that be okay? Great. So what I'm going to do is I'm going to have a look quite deeply from your head down to your stomach. So we'll get started by checking your head. And I'm just going to use my hands for now. So I'm just going to get up and just have a look. I'm just running my fingers through your hair, and that feels nice and soft. I see no dandruff or any lesions or any bumps of any kind. Haven't had any injuries recently. Okay, good. And it's nice and firm here. Okay. Just one quick look again. Alright. Wonderful, that's all very good. So now I'm going to be checking your ears. Do you have any concerns with your ears at all? Alright, good. So if you just like to turn your head slightly. Good, and okay, now when I pull on them, let me know if you feel any comfort, okay? Anything uncomfortable. Okay. And just turn to the other side. And again I'm pulling. Okay, and just nothing here either. Great. Okay, so what I'd like to do now is I would like to just check your temperatures in your ears. So okay, it's a nice good temperature, and just on the other side. Okay, that is a very healthy temperature. Okay, perfect. Now I'm going to have a nice look inside your ears, and I'm just going to be using a light, okay? I'm just going to check your drums and see if there's any impacted wax on either side. So you can just turn your head slightly, thank you. Alright. Okay, so you have got slightly a little bit of wax impact. And I can see your eardrum. Okay. Membrane. Alright. Okay. It doesn't hurt if I go deeper in, does it? Okay, just a slight dullness. Alright. Okay. And just on the other side, I'm going to got slight wax impact here as well. And okay, so you do have a little bit of wax impact. What I would like you to do is I would recommend seeing an ENT doctor. Do you have any muffled sound at all? You do? That's probably why you've got the wax impact. I can give you a referral if you'd like to go see an ENT doctor, and they'll be able to give you a nice thorough cleaning. Lovely. Okay, now let me know when the noises stop coming out your head. Just face forward to me. Okay. Good. And on the other side. Good. And I'm just going to take my gloves off. Just a moment. And I'm going to do the same thing but clicking inside your ear. Okay. Good. And again. Okay, good. And just on the other side. Okay, good. And again. Okay, great. And what I'm going to do is I'm going to whisper some words in your ear, so just close your eyes for me, and I'm going to say three words, and you just let me know which ones that you say after I've said them. Okay? Okay. Samwise, Gamgee, Frodo. Very good, thank you. And just on the other side. Merry, Pippin, Baggins. Great, wonderful, thank you very much. Okay, so I'm going to drop down your eyes. So just come a little bit closer for this if you don't mind. Going to just drop your eyes here, and if you can follow in the direction when I ask you to. Okay, so if you can just look up for me. Okay, and look to the right. Okay. And to the left. And just look down for me. Okay. Good. Now I'd like you to follow my finger. So keeping your head straight, so if you can just look at a point on the wall, just keep looking and just follow just with your eyes, okay? Look here for me. Okay, good. And again. Okay. I don't see any wobbly movements in your eyes to detect anything serious. Okay, good. Okay, so I'm going to shine a light inside your eyes now. So I'm just going to check your pupil reflexes. Okay, and just on the other side. I'm going to have a look deep inside your eyes, behind your eyes, at your nerves. So what I'd like to do, I'm going to come a lot closer now for you. So I'm just going to check my light, and here we go, coming a little bit closer now, and look. You can see the nerves behind your eyes. Pineal gland, pituitary gland. Okay, and just on the other side here. Okay, and here we go. Just a little bit closer. You're doing very good. Okay, great. Good job. Okay. Very well done. Okay. So, again, what I'm going to do, a little bit like the finger, I'd like you to stare at the wall straight ahead. And just do it from different angles again, and I just want you to follow the light for me. Good, and again, just on the other side. Okay. So get this light to work. There we go. Great. Okay, great. If you can just look up for me. Great. I'm just going to have a look inside your nose. Okay, great. Great. And if you can just flare your nostrils for me. Good. Okay. And just put your head down just a little bit. You just open your mouth for me. Okay, and go ah. Okay, looking at your tonsils. Okay, your teeth look very nice and clean, which is a bonus. Thank you very much. Okay, now I'm just going to lightly press around your face, and if you can let me know if they feel the same on each side. Okay, same on each side? Good. Again? Yeah. Just nose here. Great. And here. Here. Great. And just here and here. Lovely, thank you. Okay, now what we need to do is I want you to do some facial expressions, okay? So I want you to give me a big smile. Great. And frown for me. Okay. And look sad for me. Great. Look very concerned, like, yeah, like that. Okay, good. And raise your eyebrows quite high. As high as they can go. Great. And just squeeze your eyes tight together and don't let me open them. Okay. Good. And I'm just going to just feel around your jaw area. Just put your head down a bit more. Thank you. Okay. Nothing feels horrid there. Okay, and just let me know if this hurts. I'm going to press down on your sinuses, so any pressure. No pressure there? What about here? Okay. Nothing there? And just pressing here on your nose. Okay. Nothing there? Okay, good. Very nice. Okay, so I'm just going to feel around your neck now. Just at your glands. Okay. So okay. Glands are a little bit swollen. Have you been coughing recently? I'm just going to get up and just feel this part of your neck here, and when I ask you to swallow, if you can do that for me. Okay, so. Okay. Okay, and if you can just swallow for me. Good. I'll do it again in just a moment. Okay, and swallow again. Great, and I'm just going to check your pulse. Okay. Very good. Okay, and your pulse is very nice. So I'm going to have a look and listen to your neck for just a moment. Okay. So I'm just going to. Okay. Just breathe normally for me. Okay, good. And just on your clavicle bones. Okay, they feel good too. Okay, so I'm going to come round to the back of you now, okay? And I'm going to have a listen to your lungs. Go to back here. Right. Okay. So if you can just give me, if you can just breathe a deep breath in for me. And out. Okay, good. And again, breathe in. And out. Breathe in. And out. And I'm just going to come around to the other side now. Okay. So you can just breathe in for me again. And breathe out. And in through your nose and out through your mouth. Great. And just do that once more for me. Breathe in and out. Okay, good. So what I'm just going to do, just from here, I'm just going to lightly tap against your back. Just hover over for this one. good. And just on the other side. So what I want you to do now is I just want you to cough for me. Thank you. And just again. Thank you very much. Okay. Alright, so now I'm going to check your heart now. There's 4 points that I need to have a look at. So if you can just hold your shirt open for just a moment. Okay. Okay. Great. You just breathe in for me again. Okay. And breathe out. Lovely. And breathe in for me. And out. Good. And just going to feel the upper part near your breast. So, breathe in for me. And out. Breathe in. And out. Just one more here. Breathe in for me. And out. And again. And out. Great, thank you. Now just one last thing with the stethoscope. I'd like you to say the number 32. Okay. Not too loud, just very softly. And again. Great. Okay. Okay, wonderful. Well, your chest sounds very clear, which is very good. It's very pleasing. So I'm going to go down to your hands now. So if you can just put your hands out like this for me. Okay, good. They are a little bit dry. Do you usually get dry skin? Okay, just make sure that you are moisturising your skin. Something that dermatologists have recommended. Okay. Now, the only thing I would like to do is I would like to check your blood sugar level, if that's okay. It's only a very small needle, so you don't need to worry. I'm just using this little box here. This just checks to see it checks for sort of diabetes. So I'm just going to be using one strip of this. Okay. And then I'll be using this. Okay, so it's just so I'm just going to do it into your thumb, and it's just a very quick shot, okay? And what we do is we put it into the monitor. Okay, so if you can just put out your thumb for me again. Okay, so 3, 2, 1. Okay, good. Right, so I'm going to get the blood off your finger with this. Okay, just pop it in here. Okay. Very good. Right. And your glucose level is perfect. Right. Very good. Didn't hurt. You don't need bleed for just a moment. Okay, we'll just throw that over there into the bin. Okay. So what I want you to do now You're feeling okay? Okay, good. So what I want you to do now is I want you to clench your fists as fast as possible. I'm just going to hold them. Okay, good. And just do this with your hands. Now I'm going to squeeze them like this, but resist for me. Okay, good. And if you can just hold out your arms like this and just put them above your head. Okay, good. And slowly put them in front. Okay. And just with your head as well, I just want you to lean to the side like this. Okay, good. Slowly and just straight back up again. And to the other side. Great. And head back. You should be able to feel a nice stretch along your neck. Okay, good. And forward. Okay, and if you like to go to the side like this for me, and resist when I push. Okay, good. And just to the other side. Okay, so resisting when you're pushing, great. Your hands seem nice and perfect, nice and strong. Just going to have a quick feel of your arms, okay? Great, and just on the other side. Okay, wonderful. Now we're going to have a look at your stomach now. So if you can just sort of lean back in your chair, it should automatically lean back like this. Okay, good. And just above here. Great. So I'm going to have a nice look at your stomach and your bowel. And this is the last part of the test today. So I'm going to get up, alright? And I'm just going to feel your stomach. Okay, it is nice and soft. Do you have any problems with bowel movements at all? Any IBS symptoms sometimes? Happens to everybody. Depends on what you eat as well. Some people can get a bit of an upset stomach when they eat dairy products, when they're eating too much fibre, no fibre, little things like that. So it's really good to be wary of what you eat, and especially make sure that you're drinking plenty as well. Now I'm going to press along your stomach lightly at first. So let me know if you feel any comfort whatsoever. You shouldn't do, but let me know if you do. Okay, right. Okay. I'm going to press against your spleen and your liver. And I'm going to press a little bit harder this time, okay? I'm making sure that you have the right sizes as well. So nothing down here. I'm just going to have a quick listen in my stethoscope to see if there's any sort of gurgling noises. I can take a little bit stuck there. Right. Okay, just breathe normally, it's fine. You have a little bit of gurgling in there. Have you eaten today? That's why. Okay. Alright, that sounds jolly good. Now there is one thing that I do want to do. So if you just like to sit back up So there's just one more test I'd like to do, which I have forgotten to do when we did your back. I would like to just feel your spine. Okay. Alright. So I'm just going to feel it nice and soft. Make sure everything's all there. Let me know if there's any pain, so just lean forward just slightly. Okay. And spine is extremely delicate, so we can't push on it very hard. Okay, and just look straight back up for me. Great. Okay. Well, that conducts your physical examination. I would like you to go see the ENT doctor. So if you'd like to go to the administration reception, they'll be able to get that sorted out for you. But I haven't seen any problems apart from the impacted wax. Sorry, the impacted wax. So I'd like to see you again in another year, okay? And if you have any other problems, please let me know. Okie dokie. It was nice seeing you as well. Okay then. Goodbye.